The steady beep of Mateo Garcia's post-op monitor was a monotonous lullaby in the Olympus Medical Center's elite recovery ward, a testament to a successful appendectomy. Nurse Sachi Tanaka, her unassuming presence often overlooked, meticulously checked his vitals one last time. Her fingers brushed his clammy forehead, a flicker of concern crossing her face just as the first chaotic alarm shrieked. Mateo's eyes rolled back, his body seizing as the ECG monitor exploded into a horrific, twisting ribbon of ventricular tachycardia, torsades de pointes. Chaos erupted. Dr. Volkov, head of cardiology, stormed in, his usual arrogance replaced by sharp, panicked commands. Dr. Okoro, chief resident, moved with practiced efficiency, but her eyes, too, held a dawning dread. Sachi, rooted by Mateo's bedside, felt a familiar, unsettling recognition. Her quiet observation and an almost imperceptible intake of breath, a prelude to a nuanced suggestion, were instantly drowned out by the thunder of Volkov's orders. Her junior status made her utterly invisible in the frantic medical ballet unfolding around Mateo. No one saw the depth of her calm, or the ancient, intricate knowledge stirring beneath her modest exterior. They saw only a failing patient. But Sachi knew, with a terrifying certainty, that she held the key. She would save him. The shriek of the monitor was a physical assault, a siren wailing through the sterile calm of Olympus Medical Center. Mateo Garcia's post-op recovery room had instantly transmuted into a crucible of chaos. The ECG, once a reassuring cadence of regular heartbeats, now pulsed with a grotesque, twisting ribbon, ventricular complexes mutating and writhing around an imaginary baseline, the unmistakable and terrifying signature of torsades de pointes. Dr. Alexander Volkov, head of cardiology, a man whose reputation was as meticulously sculpted as his severe haircut, swept into the room, his very presence a command. His initial arrogance was a thin veneer, already cracking under the pressure. Torsades. Magnesium sulfate, now. His voice, usually a measured baritone, was clipped, sharp. Dr. Okoro, get that crash cart wheeled in and prepped. Fast as you can. Dr. Ngozi Okoro, chief resident, a woman whose ambition burned as brightly as her intellect, moved with practiced, almost robotic, efficiency. Her eyes, however, betrayed a flicker of concern that she quickly suppressed. She was Olympus personified, disciplined, precise, utterly dedicated to the rigid protocols that underpinned the hospital's elite status. The crash cart, already humming with latent power, was maneuvered bedside. A nurse, not Sachi, swiftly drew up 2 grams of magnesium sulfate. Sachi Tanaka, her modest frame almost swallowed by the frenetic activity, stood closest to Mateo. Her gaze, however, wasn't fixed solely on the alarming ECG. She was watching Mateo himself. The subtle pallor deepening around his lips, the almost imperceptible tremor in his left eyelid, the faint cyanosis beginning to dust his nail beds despite the high-flow oxygen. These were not the standard signs of a textbook torsades. There was an atypical pattern here, a silent language spoken by the body that the loud clamor of alarms and commands obscured. Her mind, a quiet archive of forgotten knowledge and self-taught wisdom, was already sifting through possibilities, recognizing discrepancies. 2 grams magnesium sulfate 4 push, over 1 minute, Okoro announced, injecting the milky solution into Mateo's central line with practiced ease. Hope, a fragile commodity, hung in the air. Magnesium was the first-line defense, the standard counterattack against this chaotic arrhythmia. The team waited, eyes riveted to the monitor, willing the rhythm to convert. Seconds stretched into an agonizing eternity. The torsades, however, merely intensified its macabre dance. The twisting complexes grew wider, wilder, refusing to yield. Mateo's heart, a desperate drummer, continued its erratic beat. The monitor's relentless shriek seemed to mock their efforts. Volkov swore under his breath, a rare breach of his professional decorum. His jaw tightened. No conversion? Impossible. Give another gram. Now. His voice was edged with a nascent panic. The blueprint of his textbook knowledge was failing. Okoro, without hesitation, prepared another dose. Sachi's internal clock was ticking. She knew. She had seen this. This wasn't the typical hypomagnesemic torsades that magnesium would quell. This variant, responsive to different, more nuanced stimuli, lurked in the deeper currents of her self-study. She felt the quiet urgency building within her, a silent scream against the mounting chaos. As Okoro prepared the second dose, Sachi ventured, her voice barely a whisper against the din, "Dr. Volkov, his capillary refill, it's profoundly delayed. And his facial twitch is quite distinct from typical electrolyte-induced tremors." She gestured subtly towards Mateo's face, hoping to draw attention to the minute, yet significant, cues. Volkov, however, didn't even glance her way. His focus was entirely on the monitor, on the failing standard protocols. "Nurse, concentrate on the patient's airway. We need to intubate if this continues." His dismissive tone was a familiar sting, reinforcing her junior status, her invisibility. Okoro, too, gave her a fleeting, impatient glance before turning back to the task at hand. Rules, not subtle observations, governed Olympus. The second gram of magnesium infused. Still nothing. The torsades raged, unyielding. Mateo's blood pressure, once stable, was now plummeting rapidly. 70/40ths mmHg. His oxygen saturation dipped to 85%, then 80%. His skin was clammy, mottled. "He's unstable." "Pulseless?" Volkov barked, his eyes wide with a dawning fear. He palpated Mateo's carotid artery, his touch frantic. "No." "Still a pulse, but thready. We need to cardiovert." He grabbed the defibrillator paddles himself, his hands trembling slightly. "Charge to 200 joules." Synchronized. The room held its breath. The defibrillator hummed, building its potent charge. "Clear." Volkov roared, pressing the paddles firmly against Mateo's chest. The jolt arced, Mateo's body spasmed violently, arching upwards before collapsing back onto the gurney. For a glorious, fleeting moment, the monitor showed a stable sinus rhythm. A collective sigh of relief started to ripple through the room. But just as quickly, the chaotic torsades returned, as if mocking their brief victory, twisting and writhing with renewed ferocity. The heart, momentarily shocked into submission, rebelled. Again. 300 joules. Volkov commanded, his face now a mask of grim determination, flecks of sweat beading on his temples. The air crackled with tension, the acrid smell of ozone mixing with the metallic tang of fear. Another jolt. Another fleeting conversion. Another swift relapse. The repeated defibrillations were taking their toll. Mateo's chest was reddened, his body battered. His vital signs continued their inexorable descent. BP 60/30ths mmHg. Oxygen saturation 75%. His pupils, once reactive, were now sluggish, dilating slightly. Sachi's gut twisted. They were losing him. The standard playbook, the rigid ACLS protocols that Olympus held so sacred, were failing catastrophically. The very brilliance of Dr. Volkov, his adherence to established science, was blinding him to the unusual. He was following the map, but they were no longer on the path. He couldn't see the specific, rare deviation that Sachi, through her unorthodox learning, recognized with terrifying clarity. Her knowledge felt like a heavy stone in her chest, desperately wanting to be heard, yet held captive by the very hierarchy designed to save lives. The next step, she knew, would be amiodarone, another standard drug destined to fail this particular variant. The precious seconds were draining away, and Mateo was slipping further into the abyss. Amiodarone, 300 mg 4-push, stat. Volkov's voice, usually a calm baritone, now held a sharp edge, reflecting the tremor in his hands. Dr. Okoro, her brow furrowed in concentration, was already drawing the antiarrhythmic into a syringe. The drug, a powerful Class 3 antiarrhythmic, was the next logical step in the ACLS algorithm for refractory TDP. It was a Hail Mary, but a prescribed one. Sachi watched, her heart a leaden weight in her chest. She knew it wouldn't work. Not for this. The specific variant Mateo harbored, a whisper of a diagnosis from forgotten texts and old-world wisdom, mocked the very precision of modern medicine. She saw the familiar glint of determination in Ngozi's eyes, a reflection of every resident's indoctrination into the sanctity of protocols. But here, protocol was a death sentence. Ngozi swiftly injected the drug into Mateo's central line. The room fell into an agonizing silence, broken only by the frantic chirping of the cardiac monitor and the rhythmic whoosh of the ventilator. Every pair of eyes was glued to the screen, willing the chaotic squiggles of torsades de points to coalesce into a stable, rhythmic heartbeat. For a fleeting moment, a few of the polymorphous QRS complexes seemed to lengthen, the rhythm appearing less frantic. A collective sigh of relief started to ripple through the room, quickly stifled. The brief reprieve was a cruel mirage. Within seconds, Mateo's heart muscle, already exhausted by the sustained electrical chaos, seemed to rebel with renewed ferocity. The TDP returned with a vengeance, the QRS complexes twisting and turning across the screen in wider, more grotesque parabolas. The monitor shrieked a fresh torrent of alarms. His heart rate, already unsustainable, spiked to an alarming 250 BPM, then momentarily dipped, only to rocket back up, a terrifying dance on the precipice of asystole. Damn it! Volkov slammed a fist onto the console beside the bed, the sound echoing the despair rising in the room. His face, usually a mask of control, was now pale, streaked with sweat. The veneer of brilliance was cracking, revealing the raw, panicked human beneath. He had exhausted the standard arsenal, and Mateo Garcia was still dying. Mateo's body, despite its paralysis, seemed to writhe with the internal torment. A faint, almost imperceptible tremor flickered at the corner of his left eye, a fleeting facial twitch Sachi had seen before, described in her grandfather's faded journals as a precursor to severe vagal dysregulation in certain cardiac presentations. She moved closer, subtly, to check his capillary refill. She pressed firmly on his fingernail bed. The blood returned sluggishly, taking over 3 seconds, a stark indication of profound peripheral vasoconstriction and failing circulation, more severe than the dropping blood pressure alone suggested. This wasn't just refractory TDP, it was a specific, vagal-sensitive refractory TDP variant, as clear to Sachi as if the monitor had flashed the diagnosis in bold text. His heart, "It's not just electrical," Sachi murmured, almost to herself, her voice barely audible over the din of alarms. She was speaking in code, a language the elite physicians around her weren't trained to understand. The vagal tone, it's profoundly imbalanced. Standard treatments are exacerbating it. Dr. Okoro, wiping sweat from her brow, glanced at Sachi. Nurse Tanaka, now is not the time for speculative theories. We're fighting for his life here. We need solutions, not esoteric musings. Her tone was sharp, but laced with a growing desperation that betrayed her professional exterior. Volkov ignored them both, his eyes fixed on the flatline sections that were appearing with increasing frequency between bursts of TDP. He's arresting. Another shock. Charge to 200 joules, he bellowed, his voice hoarse. The paddles delivered another jolt, tearing through Mateo's already compromised myocardium. His body arched violently, then slumped back. The monitor, momentarily stunned, resumed its chaotic display, perhaps even more erratically than before. The electromechanical dissociation was becoming profound. His carotid pulse was thready, almost imperceptible. He's in PEA, Dr. Volkov. No discernible pulse. Ngozi cried out, confirming Sachi's grim assessment. Pulseless electrical activity, a heart rhythm on the monitor, but no mechanical contraction to generate a pulse or circulate blood. The ultimate failure. A sickening realization dawned on Volkov. They were at the end of the road. Standard medicine had failed. His mind, trained for precision and protocol, raced for an alternative, any alternative, however drastic. We've tried everything. Magnesium, defibrillation, amiodarone, overdrive pacing. His voice trailed off, his gaze landing on the surgical instrument tray in the corner, gleaming under the harsh operating lights. An unthinkable thought began to form. We need to open him. Immediately. Cardiac tamponade, or a severe structural issue causing this refractory state, Volkov declared, his voice regaining a chilling clarity born of sheer desperation. Prepare for emergency thoracotomy. We'll expose the heart, perform direct massage, possibly a pericardial window to relieve pressure. Get cardiothoracic on the line, now. A collective gasp went through the room. Open heart surgery, here? Now? For a post-appendectomy patient? It was an act of last resort, a brutal, invasive procedure with incredibly low survival rates under these emergent circumstances. The very mention of it underscored the utter failure of all preceding efforts. It was a physician's admission of defeat, masked as a final, desperate offensive. Sachi's breath hitched. Open heart surgery for a vagal-sensitive arrhythmia wouldn't just be ineffective, it would almost certainly kill him. The trauma of the procedure, the sudden shift in intrathoracic pressure, the direct manipulation of the heart, it would send Mateo's delicate autonomic nervous system into terminal collapse. Her internal conflict reached a fever pitch. She had to speak. The hierarchy, the unspoken rules, the fear of ridicule, it all paled in comparison to the horror of what was about to unfold. Mateo Garcia was on the brink of being carved open, not for salvation, but for a mistake born of blindness. She knew the precise combination, the exact maneuvers that could bring him back. She had to break her silence. The subtle cues, the facial twitch, the sluggish capillary refill, the wild, atypical TDP on the monitor, they screamed vagal-sensitive refractory TDP variant to her. And she had the antidote. Time was running out. Volkov's hand reached for the phone, the words cardiac surgeon on his lips, a death knell echoing in the room. The air crackled with desperate finality. But then, a quiet voice cut through the chaos, steady and clear as a bell. I can stabilize him. All eyes snapped to Nurse Sachi Tanaka, an unassuming figure defying the storm. It's a vagal-sensitive refractory TDP variant. The pronouncement hung heavy, doctors frozen in disbelief. Can this humble rookie truly stand against the titans of Olympus? What an incredible moment. Will Sachi succeed? Will she be dismissed? Don't miss the epic payoff to this underdog story. Make sure you hit that subscribe button to follow Sachi's journey to turn the tide. Prepare for urgent consult with cardiac surgery. Mateo Garcia is failing on standard ACLS. We're out of options. We need to open him up, now. Dr. Volkov's voice, usually a confident baritone, was frayed, etched with a raw edge of panic he fought to conceal. He turned to the nearest resident, his eyes wide and unfocused, already visualizing the sternotomy. Sachi's breath, which had hitched with dread, now felt like a lead weight in her chest. Open heart surgery. The words echoed, a death knell. It wasn't just ineffective, it was a lethal misdiagnosis for a vagal-sensitive arrhythmia. The invasive trauma, the profound physiological shock, the abrupt shift in intrathoracic pressure, it would plunge Mateo's autonomic nervous system into an irreversible spiral. She pictured the brutal incision, the exposed heart, the useless interventions, all while the true enemy, a miswired vagal reflex, throttled Mateo from within. Her internal conflict, a war between deference and duty, shattered. The unspoken rules of the Olympus Medical Center, the rigid hierarchy, the fear of ridicule, they dissolved in the face of Mateo's impending doom. She knew the precise combination, the exact sequence of maneuvers that could bring him back from the precipice. She had to break her silence. The subtle cues, the faint, almost imperceptible facial twitch that hinted at an autonomic storm, the sluggish capillary refill defying normal hydration, the erratic, wild morphology of the TDP on the monitor that was atypical even for TDP, they screamed vagal-sensitive refractory TDP variant. And she had the antidote. Time was a rapidly hemorrhaging wound. As Volkov gestured to the charge nurse to initiate the surgical team's immediate standby, Sachi took a deep, steadying breath. Her voice, usually soft and unobtrusive, found an unexpected clarity, cutting through the escalating chaos of the resuscitation bay. Dr. Volkov, she interjected, her tone calm but unwavering, I can stabilize him. It's a vagal-sensitive refractory TDP variant. The room went utterly still. The blaring alarms of Mateo's vital signs, which moments before had seemed deafening, now simply hummed beneath a profound, unnatural silence. The anesthesiologist, midway through adjusting the ventilator, froze. A resident dropped a syringe. All eyes, wide with disbelief and a flicker of offense, swiveled towards Nurse Tanaka, the quiet rookie. Dr. Volkov slowly turned, his brow furrowed, his eyes narrowing to angry slits. Nurse Tanaka, this is a code situation. We are beyond your scope of practice. This is torsades de pointes, refractory, atypical or not. We have exhausted all ACLS protocols. What precisely do you mean, vagal-sensitive refractory TDP variant? His voice was dangerously low, laced with contempt and an unmistakable challenge. He clearly viewed her interjection as insubordination, an insult to his expertise. Sachi held his gaze. The pattern of QT prolongation, combined with the extreme lability of Mateo's heart rate despite magnesium and amiodarone, and these specific autonomic cues, the irregular pupillary constriction, the subtle tremors, the exaggerated Valsalva response I observed earlier during repositioning, it suggests an underlying vagal imbalance driving the arrhythmogenesis, rendering standard sympathetic blocking or membrane-stabilizing agents ineffective, even counterproductive, Sachi explained, her voice gaining confidence with each medical observation. Standard TDP therapies, which often target sympathetic overdrive or direct myocardial stability, are being overridden by an unusually hypersensitive vagal tone. We need a precise, nuanced approach to reestablish autonomic equilibrium, not just suppress myocardial excitability. Volkov scoffed, a short, sharp burst of air. Nurse Tanaka, with all due respect, your observations are not relevant here. We are dealing with a life-threatening arrhythmia. My expertise is in cardiology, not esoteric vagal theories proposed by, who, exactly? A textbook from the 1800s? We follow evidence-based medicine, and the evidence points to immediate surgical intervention. Stand aside. Prepare him for transport. His dismissal was absolute, intended to crush any further dissent. His focus had already returned to the surgical team, his mind racing through the thoracotomy approach. As Volkov turned his back, Mateo's monitor screamed a new, more terrifying alarm. His blood pressure, already critically low, cratered further, a stark digital 0 briefly flashing, then struggling to register 30/10 mmHg. His SpO2 plummeted into the 60s. The torsades de pointes, which had been erratic, now coalesced into a grotesque, sustained ventricular fibrillation. The rhythmic twisting of the TDP was gone, replaced by the chaotic, silent tremor of a dying heart. Asystole was seconds away. Mateo's chest barely rose and fell. His skin, already ashen, took on a waxy, corpse-like pallor. Dr. Ngozi Okoro, who had been witnessing the entire exchange with a mixture of professional rigidness and growing desperation, felt a cold dread seize her. Volkov's protocol, her protocol, their protocol, had failed catastrophically. Mateo was flatlining. The unblinking green line of the ECG monitor was about to become horrifyingly, irrevocably straight. Her career, her ambition, her carefully constructed adherence to guidelines, all felt like brittle glass in the face of this undeniable, stark reality. She glanced at Volkov, who was now barking urgent commands for surgical instrument trays, his back to the patient. He was focused on the next, equally failing, step. Then her eyes fell on Sachi. Nurse Tanaka stood by Mateo's bedside, her gaze fixed not on Volkov, but on Mateo's subtle facial twitch, on the monitors, on the precise rhythm. Her posture was one of intense, calm certainty, a stark contrast to the panic gripping everyone else. Ngozi remembered Sachi's quiet efficiency, her uncanny ability to anticipate needs, her meticulous patient assessments. She dismissed it as overzealousness, but now... Mateo's jaw slackened. A faint gurgle escaped his lips. He was dying, truly dying, before their eyes. Standard medicine had failed. Volkov was about to perform a potentially lethal, certainly useless, surgery. Ngozi felt a surge of raw, primal panic, but beneath it, a desperate, illogical hope ignited. What if Sachi was right? What did they have to lose? Mateo was already gone. Dr. Volkov. Ngozi's voice, sharp and urgent, cut through his surgical instructions. Volkov spun around, annoyed. Mateo is coding again. He's in VF. We are losing him. She didn't wait for his response. Her gaze snapped to Sachi, desperation warring with a final, desperate professional gamble. Nurse Tanaka. You have 60 seconds. 60 seconds. Show us what you mean. Now. The order, raw and unprecedented, hung in the air. Volkov sputtered, outraged, but Ngozi's glare was resolute, her finger pointing emphatically at the flatlining patient. This wasn't a suggestion, it was a desperate, battlefield command. She was staking her reputation, her career, on a rookie nurse's outlandish claim. Without a moment's hesitation, Sachi moved. Her composure was almost eerie, a stark island of calm in the storm. She didn't offer further explanation or justification. Her eyes, cool and focused, scanned the resuscitation cart, already knowing what she needed. Her hands, usually gentle, moved with a swift, purposeful precision, grabbing a specific syringe, a vial of lidocaine, and then, surprisingly, a minuscule ampoule of isoprenoline. Her gaze briefly met Ngozi's, a silent acknowledgement of the desperate trust placed upon her. Then, her focus narrowed entirely on Mateo, on the rhythm, on the precise movements she was about to make. The room, though still tense, seemed to hold its collective breath, watching the unassuming nurse who had just been granted Mateo Garcia's last, impossible chance. The very air crackled with a new, dangerous electricity. Ngozi's desperate command had sliced through Volkov's stunned indecision, granting Sachi not just permission, but a heavy, ticking mandate. Sachi wasted no time. Her movements, usually graceful and unassuming, now possessed a stark, almost surgical efficiency. She didn't speak, didn't elaborate, simply moved towards Mateo Garcia's bedside, her eyes already scanning the vitals monitor with an intense, proprietary focus. The chaotic dance of torsades de points continued to convulse across the screen, the undulating, polymorphous QRS complexes twisting like a malevolent serpent, each beat a fresh assault on Mateo's failing heart. His blood pressure, barely palpable, now registered 50/30 mmHg. The oxygen saturation, clinging precariously to the mid-60s, threatened to plummet into oblivion. His skin was ashen, almost translucent, a sheen of cold sweat painting his brow. Sachi leaned over Mateo, her face a mask of calm concentration amidst the swirling panic of the room. Her voice, remarkably steady, was a low, melodic hum that seemed to cut through the alarms. Mateo, she murmured, her touch light yet firm on his clammy wrist, searching for a pulse that was more a tremor than a beat. I need you to try and listen to me. I'm going to help you. Take a deep breath for me, Mateo. A very deep breath. His eyes, glazed and unfocused, flickered towards her, a desperate, silent plea. He wasn't fully conscious, but a primal instinct for survival seemed to stir within him. His chest, with a shuddering effort, rose slightly. As he inhaled, Sachi's nimble fingers, with an almost imperceptible shift, settled on specific points, her thumbs resting gently but firmly just beneath the earlobes, angling inwards, while her index and middle fingers found precise purchase on either side of Mateo's sternocleidomastoid muscles, tracing down towards the clavicle. It wasn't a forceful, crushing grip, but a delicate, insistent pressure, almost like an ancient acupressure technique. Now, hold it, Mateo, she urged, her voice a soft command. Bear down for me, like you're trying to push something very heavy. Hold your breath, Mateo. The room held its breath with him. Volkov, still reeling, watched in a mixture of disbelief and intellectual horror. This was not in any textbook. This wasn't ACLS. This wasn't even standard vagal maneuvers, which were typically avoided in unstable TDP. Ngozi, however, watched Sachi with a desperate, unwavering focus, her earlier skepticism giving way to a raw, primal hope. On the monitor, the relentless TDP continued its deadly rhythm. But then, for a fleeting, almost imperceptible fraction of a second, the chaotic waveform seemed to hesitate. The polymorphic twists seemed to uncoil just slightly, a subtle, almost rhythmic tremor in the pattern, a momentary slowing that was gone as quickly as it appeared. It wasn't a conversion, not yet, but it was something. A ripple, a tremor in the force of the storm. Sachi's gaze remained locked on the monitor, a flicker of confirmation in her cool, green eyes. She knew. She had found the vagal-sensitive refractory TDP variant. Okay, Mateo, Sachi exhaled softly, easing her pressure. Good. You did well. Her touch lingered for another moment, a silent acknowledgement of the delicate balance she was trying to restore. The momentary, subtle effect of the maneuver faded, and the monitor returned to its desperate, untamed dance. But for the keenest eyes in the room, there had been a whisper of change. Sachi then turned, her movements already anticipating the next critical step. Her eyes swept over the resuscitation cart, her hands moving instinctively. She plucked a 10-milliliter syringe, then reached for a vial of lidocaine. Volkov's jaw clenched. Lidocaine was an antiarrhythmic, yes, sometimes used off-label for TDP refractory to magnesium, but it wasn't standard. It carried its own risks. Still, it was within the realm of plausible, if desperate, interventions. But then, Sachi's hand reached further, bypassing other more common medications. Her fingers closed around a tiny, amber ampoule, no bigger than her thumbnail. Isoprenoline. A collective gasp, hushed but audible, rippled through the tense silence of the room. Volkov's eyes widened, a fresh wave of professional horror washing over him. Isoprenoline, he barked, the word escaping him like a choked cry. His voice, usually so controlled, was laced with incredulity and outright alarm. Tanaka, what are you doing? That's contraindicated. Isoprenoline is a beta agonist. It will exacerbate torsades, increase adrenergic tone, shorten repolarization even further. It will kill him. His words were sharp, accusatory, a direct challenge to Sachi's judgment, ringing with scientific certainty. Dr. Okoro's face, which had been a steady and cautious hope, now tightened with renewed apprehension. Volkov was right. Every medical textbook, every ACLS guideline, screamed against the use of isoprenoline in TDP. It was counterintuitive, bordering on malpractice. But Sachi didn't flinch. Her hands continued their ballet of precision. Her focus was absolute, her composure an unyielding fortress against the storm of doubt and fear surrounding her. With a steady hand, she expertly snapped the top off the tiny ampoule. Then, with an almost unnerving exactitude, she drew up an incredibly precise, almost microscopic volume of the drug. A microisoprenoline dose. The syringe, held up to the light, showed barely a breath of liquid. Volkov could only stare, his mind racing. The dosage was so minuscule it was barely therapeutic for anything. Was she diluting it? What was her plan? His rational, evidence-based mind screamed defiance, yet the image of Mateo's flatlining state, the utter failure of his own expertise, held his protests in his throat. Sachi then drew up a calculated dose of lidocaine into another syringe. Her movements were fluid, unhurried, yet incredibly fast. She didn't mix them in the same syringe, understanding the potential for chemical interaction or dosage confusion. Instead, she used the Y-side on Mateo's existing 4-line, meticulously flushing each syringe before attaching the next. Each action was deliberate, imbued with a confidence that bordered on arrogance, yet delivered with a humble, almost sacred reverence for the task. Her gaze briefly met Ngozi's across Mateo's prone form. In Sachi's eyes, there was no defiance, no arrogance, only a profound, resolute certainty. Ngozi, for her part, could only offer a silent nod, a desperate gamble that had already been placed. The air thrummed with the weight of that decision, the impossible choice to trust the quiet nurse with the hidden knowledge, to bet everything on a technique that defied every established medical protocol. Mateo's monitor continued its frantic, desperate song, each spike and valley a testament to his fading life. The clock was ticking, the silence of the room broken only by the sharp, metallic click of Sachi connecting the first syringe to the 4-port. The stage was set. The unconventional treatment, born of ancient knowledge and radical insight, was about to begin. Sachi's fingers, steady as a surgeon's, pushed the plunger on the first syringe. It was lidocaine, a drug familiar to every ACLS-certified professional for ventricular arrhythmias, but its specific dosage and timing within this unique sequence were Sachi's own. She injected it slowly, observing the monitor with hawk-like intensity. Mateo's PAMD continued its chaotic dance, unyielding, but Sachi's gaze remained fixed, searching for the subtle, physiological ripple she expected. The drug coursed into Mateo's veins, a conventional warrior sent into battle with an unconventional strategy. Still torsades, Sachi, Ngozi's voice was a low thrum of anxiety, her eyes darting between Sachi and the relentless monitor. The rhythm remained polymorphic, QRS complexes twisting around an imaginary baseline, each spike a fresh declaration of myocardial instability. Volkov, hovering by the code cart, his face a mask of strained disbelief, didn't speak. He watched Sachi as if she were an alien entity, performing an ancient ritual in the sterile confines of his cutting-edge facility. Sachi offered no verbal response. Her response was in her actions, her focus absolute. She reached for the second syringe. This was the true gamble, the unorthodox element that defied textbook logic, the microisoprenaline. Isoprenaline, a non-selective beta-agonist, was typically a potent chronotropic and inotropic agent, used to increase heart rate and contractility, often in profound bradycardia. In the context of torsades de pointes, which is often exacerbated by sympathetic overdrive or prolonged QT intervals, administering isoprenaline was counterintuitive, bordering on malpractice. It could accelerate the arrhythmia, drive the heart into irreversible fibrillation. But Sachi's knowledge of the vagal-sensitive refractory TDP variant encompassed a paradoxical understanding of its electrophysiology. She knew that in this specific variant, the profound vagal tone combined with the specific ion channel dysfunction was creating a repolarization abnormality that, counterintuitively, a microdose of isoprenaline, carefully titrated, could stabilize. It wasn't about increasing heart rate, it was about subtly altering the action potential duration in a way that regularized the repolarization phase, especially under the precise conditions she had already established with the vagal maneuver. It was like tuning a delicate instrument with a tool meant for heavy machinery, but applied with surgical precision. With painstaking slowness, Sachi administered the microisoprenaline. Her thumb on the plunger was as steady as the rhythmic pulse she sought to restore. Each nanogram of the drug was a calculated risk. The syringe emptied. The room held its breath. The only sound was the incessant, terrifying beep of Mateo's cardiac monitor, still screaming torsades de pointes. Volkov flinched, his jaw clenched, expecting the worst, his mind already formulating the scathing report, the legal fallout. Ngozi leaned forward, her knuckles white as she gripped the rail of the bed, her hope, fragile as spun glass, teetering on the edge of oblivion. 1 second. 2 seconds. 3. Then, imperceptibly at first, a subtle change. The grotesque, polymorphic waves on the monitor didn't immediately flatten. Instead, there was a fleeting moment of heightened disorganization, a chaotic burst that made Ngozi gasp, "It's worsening." But Sachi's eyes, trained to discern the most infinitesimal physiological shifts, remained serene. She saw not worsening, but a critical inflection point. A threshold. Then, a sudden, profound silence on the monitor. Not a flatline, but a brief, startling cessation of the chaotic rhythm, a momentary electrical pause that stretched for what felt like an eternity. Volkov's breath hitched. Ngozi's heart hammered against her ribs. And then, as if a conductor had brought down her baton with perfect timing, a single, perfectly formed QRS complex emerged. Then another. And another. Each one identical, crisp, and clear. The polymorphic twisting vanished. In its place, a steady, rhythmic progression of P waves, QRS complexes, and T waves. A perfect, unwavering sinus rhythm. Mateo's heart rate, which had been vacillating wildly between 180 and 220 BPM in chaotic bursts, now settled into a steady, powerful 85 BPM. The change wasn't just on the monitor. A wave of pink began to wash over Mateo's ashen skin. His chest, which had been heaving erratically, now rose and fell with a smoother, more even cadence. The rapid, shallow respirations began to deepen. "Check his pulse," Sachi's voice, calm and even, cut through the stunned silence. Ngozi, still disbelieving, reached for Mateo's carotid. Her fingers met a strong, regular, bounding pulse. "Strong, 8.5, she stammered, her voice thick with awe. The automatic blood pressure cuff, which had struggled to register a meaningful reading for minutes, now beeped softly. The display flashed, 118/72 mmHg. SpO2 rapidly climbed from a precarious 82% to a robust 98%. The room exploded, not with shouts, but with a collective, astonished exhale. The medical team, who moments ago were preparing for a desperate open-heart procedure, now stood frozen, witnessing a miracle. Volkov, head of cardiology, a man whose ego was as formidable as his intellect, stared at the monitor, then at Mateo, then at Sachi. His mouth was slightly open, a silent testament to his utter disbelief. The color had drained from his face, replaced by a pallor of shock that mimicked Mateo's earlier complexion. He blinked, as if expecting the image to flicker, to revert to the terrifying dance of torsades. But the sinus rhythm held, unwavering, strong. Ngozi, tears welling in her eyes, couldn't suppress a raw, choked sob of relief. She had gambled everything, risking her career on Sachi's impossible claim, and Sachi had delivered. A patient who had been moments from certain death was now stable, his heart beating with renewed purpose. Sachi, oblivious to the stares, the wonder, the dawning respect, simply adjusted the 4-drip for a maintenance infusion of lidocaine, ensuring the rhythm remained stable. Her hidden knowledge, born of forgotten wisdom and tireless self-study, had not just saved a life, it had cracked open the very foundation of Olympus Medical Center's rigid hierarchy. The quiet nurse, dismissed and underestimated, had just performed a feat that defied modern medicine, leaving brilliant minds humbled and speechless in her wake. The silence that followed Mateo's miraculous conversion was heavier than any defibrillator paddle. It wasn't the startled hush of a medical crisis, but the profound quiet of a world profoundly shifted. The rhythmic, steady beeping of the monitor displaying Mateo's perfectly stable sinus rhythm seemed to reverberate through the very bones of the room, a stark counterpoint to the panicked chaos of moments before. Volkov stood frozen, his face a canvas of disbelief, his eyes darting from Sachi to the monitor, as if expecting the image to glitch, to revert to the terrifying dance of torsades. But the sinus rhythm held, unwavering, strong. Ngozi, tears now openly streaming down her face, didn't wipe them away. She simply stared, a raw, choked sob of relief escaping her. She had gambled everything, her entire promising career, on Sachi's impossible claim, and Sachi had delivered. A patient who had been moments from certain death was now stable, his heart beating with renewed purpose, a testament to an audacious act of medical heresy. Sachi, oblivious to the stares, the wonder, the dawning respect, simply adjusted the 4-drip for a maintenance infusion of lidocaine, ensuring the rhythm remained stable. Her hidden knowledge, born of forgotten wisdom and tireless self-study, had not just saved a life, it had cracked open the very foundation of Olympus Medical Center's rigid hierarchy. The quiet nurse, dismissed and underestimated, had just performed a feat that defied modern medicine, leaving brilliant minds humbled and speechless in her wake. It was Volkov, finally, who shattered the silence, his voice rough, stripped of its usual imperious edge. He took a staggering step forward, gesturing wildly at the monitor, then at the empty syringes on the tray. What did you do?" he demanded, his eyes wide, his brow furrowed in a desperate attempt to reconcile what he'd witnessed with everything he knew. The question wasn't hostile, not truly. It was born of pure, unadulterated shock and a desperate need for understanding. Sachi turned, her hand still steady as she capped a needle, her movements precise and unhurried. Her dark eyes met Volkov's, then swept across the stunned faces of the other residents and nurses. There was no triumph in her gaze, only a quiet calm, a lingering intensity from the focused battle she had just fought. Mr. Garcia presented with a very specific, acquired form of torsades de pointes, Sachi began, her voice soft but clear, cutting through the lingering tension. It was not a typical long QT syndrome, nor solely bradycardia-dependent TDP, which is why standard ACLS protocols, defibrillation, magnesium, amiodarone, were ineffective. The underlying mechanism, as I observed from his subtle physiological cues, was a vagal-sensitive refractory TDP variant. A low murmur rippled through the room. Vagal-sensitive? Ngozi echoed, stepping closer, her earlier skepticism replaced by an almost palpable thirst for knowledge. I've never encountered such a variant in the literature. What cues? And how could vagal sensitivity lead to refractory TDP? Sachi nodded, her humility belying the revolutionary nature of her explanation. His initial presentation, the atypical facial twitch that was more pronounced with each TDP episode, the capillary refill pattern that fluctuated precisely with his vagal tone rather than systemic perfusion, even the subtle shift in the T-wave morphology just before each recurrence, these were my indicators. This variant is not about primary QT prolongation in the traditional sense, but an extreme heterogeneity of repolarization that becomes critically unstable under specific, aberrant vagal stimulation. His intrinsic vagal pathways, instead of protecting against arrhythmia, were paradoxically exacerbating it, creating focal areas of delayed repolarization, and thus, the perfect substrate for reentry. Volkov slowly, unconsciously, moved towards the monitor, his gaze now fixed on Mateo's ECG. Heterogeneity of repolarization, aberrant vagal stimulation, he muttered, processing. But, isoprenaline? You administered microisoprenaline. In TDP, especially polymorphic VT, a beta agonist can be catastrophically proarrhythmic, increasing myocardial oxygen demand and potentially worsening the QT interval dispersion. His voice was rising again, but it was the voice of a brilliant mind grappling with a profound paradox, not an arrogant superior. Precisely, Sachi affirmed, her explanation meticulously detailed. The key was microisoprenaline, alongside a precise vagal maneuver and the lidocaine. Magnesium sulfate primarily acts by reducing calcium influx and stabilizing the myocyte membrane, but in this specific variant, the pathological pathway wasn't primarily calcium overload. Amiodarone, while prolonging repolarization, was unable to address the underlying vagal-induced repolarization dispersion without a counterbalancing force. She paused, taking a breath. The vagal maneuver I employed was not the Valsalva for standard SVT. It was a targeted stimulation, designed to transiently reset the autonomic balance, disrupting the immediate vagal sympathetic dysregulation that was driving the arrhythmia. It created a brief window of opportunity. The lidocaine, a sodium channel blocker, then acted to shorten the action potential duration, increasing the refractory period and dampening the ectopic foci. But for sustained stability, the microisoprenaline was critical. Her eyes met Volkov's, then Ngozi's. In this variant, the extreme vagal dominance was paradoxically destabilizing. A precise, minute dose of isoprenaline wasn't intended to induce tachycardia, but to provide a subtle, controlled sympathetic counterregulation. It helped to homogenize the repolarization, preventing the rebound vagal surge from immediately re-triggering the arrhythmia. It was about achieving a fragile autonomic equilibrium, preventing the pendulum from swinging back to destabilizing vagal overdrive. A silence of comprehension, not just shock, settled over the room. The residents exchanged wide-eyed glances. No one had ever heard TDP explained like this, with such an intricate understanding of autonomic interplay and myocardial electrophysiology. Where did you learn this, Nurse Tanaka? Ngozi asked, her voice hushed, reverent. This isn't in any textbook. Not any modern one, at least. Sachi's gaze softened, a hint of a distant memory in her eyes. My grandmother was a village healer, in a remote part of Japan. She taught me to observe, to see patterns in the body no one else saw. Her remedies were often unconventional, rooted in centuries of observation and folk wisdom. She then gestured vaguely. And my own studies. After I became a nurse, I found old texts, forgotten case studies from early cardiac electrophysiology, some even referencing practices from pre-modern Europe and Asia. I synthesized what I learned. This particular variant, the vagal-sensitive refractory TDP, was documented in some very obscure German and Japanese papers from the early 20th century, often associated with specific acquired conditions or subtle genetic predispositions that modern diagnostics often miss. She picked up a discarded ECG strip, her finger tracing a subtle indentation near the QRS complex. The microisoprenaline, in combination with the lidocaine and the vagal reset, targets the specific ionic channels and cellular pathways implicated in this variant, pathways that were resistant to standard antiarrhythmics because of their unique autonomic gating. Volkov, a man who built his career on being the smartest person in any room, felt a humbling, almost terrifying respect bloom in his chest. He, a renowned cardiologist, had just been educated by a rookie nurse whose knowledge stemmed from ancient wisdom and forgotten science. He looked at the perfectly regular ECG, then at Sachi, whose unassuming demeanor was a stark contrast to the revolutionary knowledge she possessed. She had saved a patient he was about to give up on, with a diagnosis and treatment pathway that defied every modern guideline he had painstakingly memorized. The hospital hierarchy, built on degrees, publications, and reputation, felt suddenly, irrevocably, shattered. The air in the cardiac intensive care unit, usually thick with the metallic tang of antiseptics and the hushed urgency of critical care, felt different now. Lighter, charged with an unspoken understanding that something profound had transpired. Mateo Garcia's ECG hummed a steady, reassuring sinus rhythm across the monitors, his blood pressure stabilizing, oxygen saturation climbing back into the healthy range. He was still intubated, still sedated, but undeniably alive, his heart beating with a regular, unburdened cadence that had been utterly absent minutes prior. Dr. Alexander Volkov, whose earlier panic had verged on outright collapse, had retreated to a quiet corner, his face a mask of profound introspection. He didn't bark orders or demand explanations immediately. Instead, he pulled out his phone, not for a call, but to begin a frantic, almost obsessive dive into obscure medical literature. His fingers flew across the screen, searching for vagal-sensitive refractory TDP variant, lidocaine microisoprenaline torsades, autonomic gating cardiac arrhythmias. He cross-referenced textbooks from his digital library, scoured rare case reports in forgotten journals, even looked into historical medical accounts of rhythm disturbances that predated modern electrophysiology. He was looking for Sachi's explanation, not to disprove it, but to understand it, to find the scientific anchor for what he had just witnessed. Meanwhile, Dr. Ngozi Okoro, still buzzing with adrenaline but now tempered by a burgeoning sense of awe, moved to Sachi's side. "Nurse Tanaka," she began, her voice softer than usual, "that was. I've never seen anything like it. The specificity of your diagnosis, the precise drug combination, the vagal maneuver, it was like watching someone rewrite the textbook in real time." Ngozi's ambition had always been tied to hierarchy and established protocols, but Sachi had just demonstrated a level of mastery that transcended both. "You mentioned ancient wisdom, self-taught techniques. Can you elaborate? When Mateo crashed, every algorithm, every guideline we were taught, failed. Utterly." Sachi, despite the flood of praise and the weight of the moment, remained characteristically composed. She helped the other nurses with the meticulous post-resuscitation care, adjusting Mateo's infusion rates, documenting vitals. "Dr. Okoro," she said, her voice quiet but clear, "the heart is a complex system, influenced by more than just electrical impulses. My grandmother, a traditional healer, taught me to observe the whole patient, not just the numbers on a screen. Subtle cues, the particular way Mateo's jaw twitched, the distinct pattern of capillary refill that indicated a unique autonomic imbalance, distinct from typical TDP cases which usually respond to magnesium or pacing, these are signposts. My self-study involved merging that ancient observational wisdom with modern understanding of ion channelopathies and pharmacodynamics. The variant, as I understand it, has a unique susceptibility to vagal tone modulation in conjunction with targeted sodium and beta-adrenergic pathway blockade." Ngozi listened intently, her skepticism dissolving into a genuine desire to learn. She saw not just a nurse, but a formidable clinician whose insights were deeper than any she'd encountered in years of rigorous training. The rigid boundaries of their professional relationship, once clearly defined by rank and experience, began to blur. Ngozi, the ambitious chief resident, felt a mentor-mentee dynamic forming, but with Sachi as the unexpected, profound guide. Mateo Garcia's recovery was nothing short of miraculous. Within 24 hours, he was extubated, lucid, and able to communicate. His heart rhythm remained stable, requiring only routine monitoring. The damage that a prolonged, uncontrolled arrhythmia typically inflicts on the myocardium was absent, a testament to the speed and efficacy of Sachi's intervention. He spent a few more days in recovery, bewildered but immensely grateful, before being discharged with a clean bill of cardiac health, a living embodiment of Sachi's hidden brilliance. Volkov emerged from his research sanctuary 48 hours later, looking utterly exhausted but radiating a newfound intellectual energy. He called an unscheduled departmental meeting, bypassing usual formalities. "Colleagues," he began, his voice gravelly, "we faced an extraordinary challenge this week. A patient, Mateo Garcia, presented with a torsades de pointes variant that defied every established ACLS protocol. We were at a loss." He paused, looking around the room, making eye contact with every physician, every resident. It was Nurse Sachi Tanaka who, through her extraordinary observational skills and profound, self-taught understanding of cardiac electrophysiology and autonomic regulation, identified a vagal-sensitive refractory TDP variant. Her treatment, a precise vagal maneuver combined with a novel lidocaine microisoprenaline regimen, successfully converted the rhythm. Volkov then projected a dizzying array of slides, obscure journal articles from the early 20th century, anatomical diagrams showing precise vagal innervation patterns, complex graphs illustrating ion channel kinetics. He meticulously detailed how Sachi's approach aligned with fragmented, forgotten, or niche areas of cardiac science. "I spent 2 days validating her reasoning," he concluded, his voice tinged with a humility few in that room had ever heard from him. Her diagnosis and treatment were scientifically sound, albeit unconventional and largely undocumented in modern literature. This incident forces us to reevaluate how we identify expertise, how we integrate diverse knowledge, and how we listen to those who challenge our established frameworks. The room was silent, electrified by Volkov's public concession and validation. The hospital hierarchy, once a rigid, unyielding structure, had indeed been fundamentally shaken. Sachi, for her part, returned to her regular shifts, quietly fulfilling her duties. She didn't seek accolades or special privileges. She still helped patients with their daily needs, still meticulously charted, still offered a kind word. But now, when she walked the halls, the glances were different. Respect, admiration, even a touch of wonder, followed her. Junior nurses sought her advice, not just on practical tasks, but on reading subtle patient cues. Residents like Ngozi now actively pulled her aside for clinical discussions, seeking her unique perspective on perplexing cases. Ngozi, deeply impacted, became Sachi's most vocal advocate within the hospital's power structure. She championed Sachi's inclusion in complex case discussions, ensuring her insights were heard and recorded. She defended Sachi against any lingering skepticism from older, more entrenched physicians, citing Volkov's public validation. She saw Sachi not as a subordinate, but as a groundbreaking colleague whose knowledge was a priceless asset. The incident with Mateo Garcia became a legend whispered through the Olympus Medical Center, a reminder that true wisdom isn't always found in the highest office or the loudest voice. It often resides in the quietest corners, nurtured by genuine curiosity and a profound dedication to healing. Sachi, with her unassuming demeanor and extraordinary expertise, had inadvertently sparked a quiet revolution. She taught them that sometimes, the most advanced solutions aren't found in cutting-edge technology, but in a deeper, more holistic understanding of the human body, in a subtle blend of ancient wisdom and modern science, and in the unwavering belief that every patient holds a unique story, waiting for the right observer to decipher it. Her presence transformed Olympus Medical Center, making it not just a place of elite medicine, but a place where humility and profound observation began to reclaim their rightful place at the heart of healing. The hospital administration, stunned by Sachi's ingenuity, swiftly offered her the lead of a new specialty diagnostics unit. Yet, true to her nature, Sachi humbly declined. Her vision was broader, to empower others. She opted instead to establish a pioneering program, training fellow nurses in the lost art of advanced patient observation and the integration of nuanced, holistic techniques. Dr. Volkov, no longer the arrogant chief, watched with genuine admiration, a silent acknowledgement of the paradigm shift Sachi had initiated. Olympus Medical Center began a new era, one where empathy and acute observational skill were valued as highly as groundbreaking technology. What did you think of Sachi's incredible journey? Would you have accepted the promotion? Share your thoughts in the comments below. Don't forget to like this video and subscribe for more inspiring medical narratives. Remember, sometimes the greatest heroes are the ones who don't seek the spotlight, but simply illuminate the path for others.